Oh, I'm going to grab my water quickly. I'm going to grab my water. Mm. Good evening, everyone, and welcome to Talking Tea Thursday. Here we are, middle of November. How's past Halloween? Now we are on to Christmas. How are you getting on with the plans? I have suddenly realised that I've got very little done. Anyway, welcome. If this is the first time you've joined us, you'll find me loitering here on a Thursday evening about this time, talking something to do with teeth. And the whole idea is to give you some help to help yourself, because it's really more about what you do 365 days a year than what happens when you visit your dental team once, twice, three times, maybe even four times a year. Way more important what you do every single day, and that is the key. But that does not mean that it is all on you. It is a team effort. I've always said dentistry is a team sport, and it involves the players, so the dental team players, and it involves you. You may say as the captain of that team, is, oh gosh, I'm definitely on a sport analogy zone. Is your dentist the referee who monitors and makes sure everything's going, gives direction. Anyway, it's probably because I'm going to sing the sports dentistry tomorrow. So anyway, let's talk about this. I'm going to share my screen and I'm going to do a little bit of jumping around because I've got all sorts of, I was going to say bells and whistles, but that's not really what it is. But we're going to have a little look about what actually happens when you put your rear end in a dental chair. So last week we looked at what goes on before you get there. So some of the stuff that you may have no idea happens that makes sure that you are in a safe, healthy, secure environment when you actually lie flat on your back and open your mouth. And I often say, and have said for years to students and professionals, where else would you put yourself in such a vulnerable position that you're lying flat on your back, you have next to no control, and sometimes it's total strangers looking at you. So, you need to feel secure. You need to feel as if you are being taken care of, and more important, you're being listened to. So let me just shift around, because as I say, this could go terribly wrong or not, but let's go. I'm gonna actually where's screen two? There's screen two. So we are going to look at this, and hopefully this is going to work. We will see. All being well, it should be working, and you should now see a picture of a mouse, which is actually not where I actually want to be at the start of this presentation, but we are going to find my way back to where I want to go. This is what happens when you you continue in a train of thought that you started previously. So let me just get back to where I want to be. Keep going, keep going, keep going. We'll get there. We'll get there. There we go. Now we are where we want to be. So from the moment you actually arrive, you are wanting to know that you're in the right place with the right people. And often I say, when you are making a dental appointment, if you're going to a new dental practice, you want to know that they are aligned with what's important to you. You will have probably filled in the paperwork beforehand. When you arrive, hopefully you'll be warmly welcomed. You may have to wait a little while. You'll be asked to fill out forms if they're NHS if you're being seen on the health service, you will have to fill out certain forms that either mean you don't have to pay for your dentistry, or you have to pay a certain amount towards your dentistry. You will definitely have to fill out a medical history questionnaire. And it may be more than just your medical history. It'll be your social and family history, and that's quite important. So things like, do you smoke? Do you drink alcohol? How much alcohol do you drink? Medications that you're on. There's quite a lot of stuff in that paperwork, and it's really important that you're quite comprehensive and quite open about how you fill that form in. But what we're going to look at this evening is really a guide of what actually happens when you go for what you would call a checkup. Most people would still refer to them as checkups, which really is not a terribly good title. It's much better description being described as an oral health assessment, because that's what it is. It is an assessment of your oral health. And if you've been before, it may be an oral health review. And if you spend any time with me, you know that I talk a lot about the dental professional's role in monitoring your mouth and helping maintain your mouth. You do a lot of the legwork, you do a lot of that hard grind. All they're there to do is monitor and maintain. And if your mouth is healthy, it also means if you want some sort of cosmetic treatment, it is going to be on very firm foundations, and anything will last better and be the way you want it to be in the long term if you are actually doing your bit at home. So really important to remember that. So they say lots of preparation before you arrive. Lots of preparation in the background, so the dental team will know who's coming in. They will know if they've got long enough to do what they've planned to do. So as it reminded you last week, you know, if you've got pain and you're going for your checkup, your health assessment, you know, please ring them and let them know, because they will probably need longer than they have allowed for that. It's really important for time management that the dental practice has left enough time to care for you properly. That said, you know, you want to be the person that is organized and arrive in decent time. And I say, if you're taking medications, it's really useful to have those printed out or written down so that you can hand them to the receptionist or whoever you speak to first, and they will add that to your records. And it's really important to know all this is done confidentially. All your records are secure, and it's not talked about elsewhere. It's your practice record, it belongs to you. So there's lots of stuff to prepare. And before you come into the surgery, your chart will be opened, usually now on a computer, because so much of dental care is technology now. But you know, your chart will be opened, your medical history form will have been scanned or updated on that. The record will be on that. Your history of any treatment up to that point will also be there, and that will be reviewed, as will any other investigations, including any x-rays, so any radiographs that you've had, any dental photography that's been taken, if there's been impressions or if there's scans. And I'm going to talk a little bit about some of those things later on. And you can see some of the sort of tools for the trade behind me here. So, you know, just, you know, I haven't got everything out. It could have got quite mental if we put everything out, but we've got quite a few things here. You may nowadays find a lot of dental professionals wearing these. Now, these are dental loops, so it's magnification, and basically it magnifies what they're seeing anywhere between 2.5 times. Some endodontists, so root canal specialists, would wear them 6 or even 8 times. So you're looking at a really large image, and it really does help to see. You see so much more when you wear loops. So you'll find various dental team members will be wearing loops these days, and it is to help the quality of what they are doing for you. So it's, you know, if you're not sure what they've got on or why, ask, you know, they'll be happy enough to share that. And if it's a new gadget, believe me, they will love to explain and tell you all about it. So they will have the surgery prepared, whatever instruments that they're likely to need, any lab work that has been organized, they will need to have your x-rays obvious, so your radiographs are clear, and anything else there. So the chair will be cleaned down between patients, the instruments will be sterile, all that sort of thing. There will be PPE for you as well as for the dental team. So you may well be asked to wear goggles or safety glasses. Whoops, just you drop them. So something like this, and quite often these can go over your ordinary glasses, but they are there again to protect you, to stop any splashes and anything getting in your eyes. So oral health assessment, it says, gives you a much better idea of what's actually going on. And how often you go for that oral health assessment or oral health review will very much depend on your oral health at that time and your ability to maintain your oral health. So it can be anywhere from maybe 3 or 4 months to 6 months, or right up to 2 years or even longer. And even if you've no teeth and you wear full upper and lower dentures, you still should be seen regularly. Really important. If for nothing else for a mouth cancer screening. And when you get into the surgery, you know, dental professionals don't know, and I don't think the smells are as distinctive as they maybe used to be, but there's certainly smells, there's sounds, which can make you feel slightly anxious. And I'm going to talk about anxiety at the end of the month. But what you'll find is a minimal set of instruments that will be out there solely for your use to be used in your mouth, and then they will go off and they will be sterilized. So it's always important that you know that you're being well looked after. Now, you may wonder why there's a caution and attention sign on that. It's really because I have got some pictures of the mouth, and not everybody particularly likes that. And probably Facebook, being Facebook, they will probably put one of those warning signs that inappropriate content or something really random, which happens to me. And those that know me well will go, what on earth are you doing this evening, Lee? So anyway, I just thought I'd like to warn you, or warn Netta, that, do you know something? We've got pictures inside a mouth. So moving on, as they say. So at each checkup or each assessment, there's going to be certain things that your dental team are going to look at. They're going to look at your teeth, they're going to look at your gums, they're going to look at your mouth, and they're going to ask about your general health and any problems that you've had with your teeth. Any problems you've had with your mouth generally, any gum problem, any sensitivity, any pain, really important. They're going to ask about all those things. They're going to offer you some advice. They might give you advice about what you're eating, about smoking, alcohol use. They will certainly want to know about how you're looking after your mouth. And they'll then want to sort of discuss about when you need to come back. And all these points are up for discussion. It's not a dictatorship. These are decisions that should be made with you rather than for you. Dental team can recommend treatment plans and care plans, but that has to be agreed by you. And there's no doubt some people don't want to have certain types of treatment, and that is always your decision. And if what's being proposed for whatever reason is not right, you can ask, are there alternatives? Because really your dental team should explain all the alternatives and let you choose what way to proceed, because that might have cost implications, it might have time implications, all those sorts of things. But I'm going to come back to that anyway. So first things first, please clean your teeth before you go for your dental visits. Please clean, and don't, as I once heard somebody say, well, what was the point in cleaning? I was going to see the hygienist, he was going to clean them anyway. Please don't do that, particularly not when you're going for your oral health assessment, because it makes such a difference when you can actually see around teeth. This is food packing in and around teeth. And that's nothing too dramatic. You know, I have seen much, much worse, because you can see actually there, you know, the gum tissue is healthy, teeth in themselves are quite clean. But this is for somebody's problem. Somebody's maybe been out for something just immediately before they come. And if you haven't got a chance to brush your teeth at home or at work, take your toothbrush and toothpaste with you and arrive in good enough time that you can go to the bathroom and clean your teeth there before you actually make it to the dental chair. So just as a little something, as they say. So NHS Inform, this is NHS Scotland, actually describe what you should expect at your dental checkup, so your oral health assessment. And that will be, they'll ask you about your general health, how your teeth have been since your last visit, if you're taking any new medications, taking any changed medications. They may ask you, are you undergoing any treatment with your doctor? Have you been hospitalized? And those sorts of things are really, really important, because things like heart disease and kidney disease and liver disease all can have a big implication on what care is, what treatment is being undertaken, and even poking around your gums and things, anything that could potentially create bleeding may have to be put on hold depending on your general health. So it's really important to be quite comprehensive in your medical history form. So it's not just a tick box exercise. There's really good reasons for your dental team to know as much as they can about you. Even things like you know, what you do for a living. If you play the trombone or a musical instrument, and you are going to undergo, say, implant treatment or orthodontic treatment, that may have a huge impact on your ability to play. So things like that are really important. It's not that people are just being nosy. It's actually really useful information for them to care for you as best as they possibly can. So they'll look at your mouth, examine your teeth, your gums, all the soft tissues. They may carry out other tests. So they may want to know if the tooth is vital, say it's been had a bang in your mouth and you want to know is it vital. So they may use something to test the vitality of the pulp, which is where the basically the life is in the center of the tooth. They may take some x-rays, and how frequently you have those and how many and the type you have, again, depends on your mouth. They'll ask about your lifestyle. So do you play contact sports? They may well recommend if you do kickboxing, they may recommend, you know, and definitely will recommend that you're wearing a professionally made mouth guard. So they might advise on diet. So if you are, I'm on a sports thing this evening, my head's in that space already. If they could advise you on diet, so if you are a marathon runner, distance competitor, they might have to advice about that. If you smoke or use tobacco products, smoking is not the only thing, or you vape, again, they will want to know about that because it has an impact on your mouth. For instance, smoking, when you're probing and checking gum health, it can give you a false sense of security because you don't get, smokers don't see the early warning signs of gum disease like bleeding, and yet it is actually one of the major risk factors for gum disease. So that's important. Alcohol, how much you have, how often you drink, and again, depending on what you drink, and how frequently you drink, how many units you drink, that can have an impact on your oral health. So smoking and alcohol in combination dramatically increase your risk of mouth cancer. So it's interesting. This is mouth cancer month is November, and one of the things I'm going to show you is a good friend, Jocelyn Harding, actually doing a mouth cancer check in dental practice. So it'll give you an idea of what is actually going on from looking at it rather than being on the receiving end of it. They might give you advice about cleaning your teeth and improving your oral health. And they'll tell you when you need to come back, when you're due to come back, and how frequently. And they'll also explain why. And all this stuff takes time, and it then might change depending on your engagement. How, you know, some people just want to put in and get out, and there's a whole lot of reasons for that. Some people just want to get out as quickly as possible because they're quite nervous. Some people just are in a rush to go somewhere else. Some people just aren't overly bothered about their oral health. And I always try and put in the context of why, because we should all be interested in our oral health because it has such a big relationship to our overall health and well-being. So it's really important that you build a relationship with your dental team so they can actually help support you and your oral health for the life that you lead, the lifestyle that you lead. So communication is really key here. And it's really important that the more information that you give them, the better equipped your dental team are to help you. So yes, lots and lots of questions. Basically, from the moment you arrive, somebody will be asking you a question, and they will also be taking notes. So when you come into the surgery, was it easy to sit in the chair? Did you hear your name being called? You know, did you look really nervous and tense? All those little things can give the dental team an idea of how best to support you. Was there any sign of swelling? Did you look unwell? Were you sort of moving your arm as if you were in pain? All these little things are indicators for actually helping them help you best. So I say you'll get a follow-up on your medical, social, family history, things that impact your oral health that I've already mentioned there. And, you know, if you're a new patient, if you've never been to this practice before, expect more questions. And if you're going, dental hygienists and dental therapists can now see patients directly without having to see a dentist first. So if you're being seen under what's called direct access, that hygienist or therapist will ask you a lot of questions. And again, it's how best to actually help and manage your oral health. So really important to fill in the paperwork, be open and honest and comprehensive about your history so they can actually help you help yourself and make sure that you're getting the appropriate care at the right time in the right place by the right person too, because I say dentistry is a team sport. You may end up seeing hygienist 2 or 3 times a year and the dentist only once a year. You may see a clinical dental technician if you need a denture made. Yeah, there's all sorts of different people. It's a bit like your medical team. There's different people do different things. So you may well be asked about how you feel about your smile. That may be on your assessment form before you come into the surgery, but certainly your dentist will go through that. Are you happy with the shape of your teeth? Is there anything that bothers you? Do you like the color of them? Because there's so much stuff now that can be done actually to enhance your smile. Certainly they'll ask if you've had any problems since your last visit, if you have any pain, any sensitivity, any aches or pains. And nearly always amazing how often you hear that, oh, well, actually, I was fine until yesterday, and I knew I was coming to see you, and you wouldn't believe that this tooth is starting to play up again. They'll ask about your home care, any problems you're having completing that home care. And that is really, really important, because our ability to look after our mouth changes throughout life, and what we need to do to maintain our oral health also change throughout life. So that's really important. And I often use the example of I turn around from here and I fall down the stairs and I break my wrist. And if I break my right wrist, I am going to have real problems trying to clean my teeth properly, because I'm desperately right-handed. So all of a sudden I'm going to have to use my non-dominant hand. If I have been flossing, well, I may not be able to do that because I need 2 hands. Using intradental brushes, I may struggle with certain things. So it doesn't take an awful lot to throw you off your game as far as looking after your mouth goes. Now, all these questions, all your responses are going to be recorded, so they take what are called contemporaneous notes. So they're basically done at that time, or as near to the time as possible. Often the notes, all these sort of little notes of record keeping, will be completed by the nurse, and then they will be reviewed and edited and completed by the clinician who's treating you at the end of the appointment. And that's really important, that all that stuff is recorded. So, you know, if you're really smoking 40 a day and you say 10 a day, you know, it's going to be recording your notes at 10, you smoke 10 a day. Likewise, medications, those sorts of things. And they may ask you things about stress as well. So all these things have an impact on your oral health as well as your overall health and well-being. So I Spy with my little eye, they are going to look in your mouth. Oh, my sides are not moving on tonight. I'm just having one of those days. Okay. So they're going to examine your mouth and do an oral cancer, mouth cancer screening. Now, if I get my act together, what I'd really like to show you is switch this screen to show you Jocelyn doing her mouth cancer screening. So bear with me and see if this works. Oh, let me see 1 second. Bear with me. Right, I think I have got it now. Where is it? There we go. Okay, so all being well, you should now be looking at Jocelyn carrying out the mouth cancer screening. So what she's doing, it's our great friend Jocelyn Harding, who is an ambassador of the Mouth Cancer Foundation. You can see she's got loops on. You can see she's got magnification, and this is a little light. But you can see what she's doing is feeling around the neck, down the jawline, along her collarbone to assess glands. She's now checking the soft tissues on the inside of her cheek and lips. You can see that. And actually, the notes on the screen there give you an idea of what she's doing. Going to check under the tongue and either sides of the tongue. Not uncommon place for mouth cancer. And you can see what she's done is taken a bit of gauze to hold the tongue, because tongues are really slippery. It'd be really hard to hold onto a tongue. So it's handy sort of retract the tongue out of the mouth and then actually look at either side. So she's checking the tongue, she's checking the back of the throat, the soft palate at the back of her mouth. So let me come back out of that. Let me get back to where I want to be. Oh, there we go. So that will be first thing that will happen when you have your dental check is your mouth cancer screening. And some dentists are really good and will say to you, yes, I am, I'm doing your mouth cancer screening now, and that is complete and everything's fine. Some just do it and don't tell you. And every time a dental professional looks in your mouth, consciously or subconsciously, they will be looking for any signs that raises concern. So really important for that. So your mouth cancer screening will be done, and that's really important. Even if you don't have any teeth, it's really important to have a mouth cancer screening done regularly. Now, they will then ask you to open your mouth. They will look at your teeth. So they're going to examine your teeth. They're going to look at how many teeth. And this is where they start calling numbers, okay? So they start calling, it depends on actually which nomenclature, there's a good word for you, which tooth numbering system or tooth describing system. You know, some people use one that sort of, they call it 1 to 8, which was my old school. Other people use 1 to 32 or 1, 1, 1, 2, 1, 3, 1, 4, depending on the quadrant. It gets very confusing. Let's not go there. But basically, if you look at the mouth as a line down the middle of your face here, and a line across there. So what happens is then it's the upper right, the upper left is as the clinician looks at it. So, okay, so you actually look at this and you go, this is the upper right one, and everything's numbered from the middle to your ear, basically. So 1's here, 8's here. If you're talking baby teeth, it's 80, just to confuse the situation, okay? So they will usually start at the back and they will work their way around, and they're looking at all sorts of things about your teeth, but they're wanting to check and see, are you missing any teeth? Have you got any crowding? They want to check how you bite together. They will look here. So this is a baby, this is child's mouth, and you can see these front teeth don't bite together, and that would be a big hint that that child sucks a thumb, a finger, or something else. So there's a tooth missing there, and you can see this tooth here has over erupted, so it's grown down a wee bit into that space. So it's one of the good reasons for actually replacing missing teeth, to make sure the bite, so how you actually include your top teeth and your bottom teeth, all goes together. So they will be looking at that. They will be looking at your fillings. They'll be looking at any other type of restorations, whether it's crowns, bridges, implants. They'll be looking at your gum health. So are your gums pale pink, firm, stippled? Do they fill the spaces around the necks of your teeth? Is there any swelling there? So they will be looking at that. Anything that's normal, anything that's abnormal. They will also be looking at the shape of your tongue. And often there are what's the term? They say assessment tools that they can use to actually record these things. So how dry your mouth is, for instance. So they'll look at, if you've got xerostomia, you've got a dry mouth, there's ways of them recording how dry it is at that time. Likewise, the same size and shape of your tongue in relation to your jaw, because that can have an impact on things like sleep apnea and so on. So I say they will be looking at all of that. They will may well take some x-rays or dental radiographs. X-rays take the picture, radiographs are what you end up with as far as the image goes. And they might use digital radiography these days. It's much more common. Everything goes into the computer, and it's quite good because they can enlarge things and do things like that. It also makes it much easier if they need to share those radiographs with another practice. Say you've been referred for orthodontic treatment or assessment of a partially erupted wisdom tooth. They can send you a radiograph, which means that you then can not have to have that same x-ray taken again, because the theory with x-rays is always you want to keep the dose that you're exposed to radiation as low as possible. And you know, dental radiation is minimal, considering how much there is in our outside environment. You hold your cell phone up beside your head, You know, there's lots of ways that we get environmental radiation. Never mind, dental radiation is minuscule in comparison to other things that we can be exposed to. That said, it is always, the dose is always as low as is practical to get the result that you want to achieve for helping you actually obtain and maintain your oral health, because there's places that you just can't actually see. So how often you have x-rays depends on a number of factors. So what age you are, what's your dental history. Most people, generally speaking, have them anywhere between sort of 6 months and every couple of years. If you move to a new practice, a new surgery, they may well want to take x-rays at your first visit, because that allows them to get to know your mouth a little bit better. There's different types of x-rays, and I'm not going to go into them all, but you can see different things. I mean, this is no PG, and you can see here's the unerupted wisdom teeth back here, okay, and the rest of the jaw. This is the middle of the face. So do you remember where I said, you know, you start 1 to 7 back there, and the jawbone over there. So it's you see the spine and the back here. So that's no PG. That's the big machine that rotates round. So that's often used as orthodontic treatment. There's also cone beam, there's all sorts of other stuff, CBCT and columns, this sort of thing to actually take a bite when x-ray, which are the most common type of x-ray. So you take the right hand side, left hand side, and gives you a picture of the premolars and molars. It doesn't give you the bottoms of the teeth. So if you're looking for something like a gum pocket or a cyst, something like that, they may take this sort of x-ray of the periapical, another one here, and you can see that gives the dental team an image that lets you see this is a dental implant, and you can see all the threads on the dental implant, and you can see how it's integrated into the bone, and you can see the crown on the top there. So x-rays give a lot more information to the dental team. And here's an example where it's really useful. So the dentist has maybe been feeling around, there's a lot of bleeding when they're touching around here, and the soft tissue is quite puffy, and they can't really work out why. Take an x-ray, and all of a sudden you can see that this filling here, it hasn't been nicely smoothed the shape of the tooth. It's got this great big overhang, and that is constantly going to gather up plaque bacteria and irritate the gum and cause inflammation. So that's the sort of thing that they will want to tidy up and actually smooth off, because that's going to make it easier for you to clean and help get that soft tissue healthy. So that's one thing that you can use them for. They can use them for early signs of decay, because the bit they can't see is right in between the teeth. So that gives them an idea there of early signs of decay. It gives them a sign of bone level. And I say lots of other information they can get, what other fillings have been done, particularly if you're a new patient will want to know what has been done, because sometimes we don't remember what treatment we've had, particularly over a lifetime. So the dental team can really help. The x-rays can really help the dental team see between your teeth and under old fillings around the margins and things, and it helps in diagnosing a problem and getting the right treatment. And you know, catching these things early is always the best and most economic way of actually managing it. So there's a variety of x-rays you maybe have. Other things that you might come across these days are, you might have a dental scan. So this is a scanner here. And what it does is it gives an image of your teeth, and the detail on scans is quite amazing. And what they're doing now, even in care homes, there's some community dental groups that are taking scanners into care homes and scanning dentures, because it means if a denture is lost, that they have got all the information they need to send to the lab to have it replaced. So they're hugely useful. If you somebody has a bad gag reflex and have struggled with this sort of thing of taking impressions, scans will make your life so much easier. And believe me, you know, when you've taken an impression and somebody's actually vomited in the middle of it in the best light, you know, you really realize how stressful having that type of impression can be. You may well have some photographs taken of your teeth. These are little retractors, and I have retractors here somewhere. And they just put your pull your cheeks back, sometimes two mirrors. It depends what kind of image you're getting. Often used with orthodontics, but they're used in many other cases. Things like tooth whitening, you want to have before and after images so that you can actually monitor changing colors. Likewise, any sort of more complex treatment. And these days, I think you're seeing more and more sort of basic things that are being done is a digital scan and photographs are taken as well. That way you have 3 dimensions, every option of knowing what a patient's mouth is like, and it gives them huge amounts of information to reflect on. So just a little bit more about a scan. It's not a picture just like you would print. It's not like that. This is the scan. Now this is the scan. It's actually, I think this is one of mine. So you can see the detail here. You can see the papilla up and behind my upper front teeth there. You can see the little ridges on my palate. You can see where there's been restorations. You can see so much detail in these things. It's really quite unbelievable how much information. Now you can see the technology. I think this is the green bits. Don't worry about that. You can see bits of shading here just where the machine has had a little hiccup. But you can see how you can see all the margins, so much detail on these things. And it makes it really helpful when you're sending anything off to a lab that the technician has this sort of detail to be working with. So those are something that are becoming more common. Now, I'm going to come out of this a wee second because I want to talk a little bit about scratching teeth. Who knew that you can scratch teeth? It's something that people say to me, see all that poking and scratching, what's that all about? Right, well, I'm going to switch my camera again. As I say, I sort of was getting a bit carried away. I've got 3 potential cameras going on here tonight. So let's have a little look. I'm going to switch to this one. Now, what I have got here is just basically an image in my mouth. The things that people say to me, see all that scratching and poking, and you know, make my gums bleed, and my gums never bleed. Well, I'm going to actually show you a little bit about the probing for gums, and I'm going to explain a little bit about it. So they will usually use a probe that has little bands on it. Give me one that actually is not one bent for some bizarre reason. Right, let's use this one. This one's got little markings on it, and you can see these have got millimeter markings. And it gives them an idea of the depth between the gum margin and where the bone is actually attached. Now, in health, that little crevice should be about 2 millimeters, okay? And what they basically will do is walk this probe around the gum margin, okay? Oops, let me move the model. I've got a model on the road here. So what they will do is basically walk this probe around every surface. And the things they're looking for is, does it bleed? And does the probe disappear? Okay. So they will be walking this around there. Okay. And what they're trying to do is work out, has there been any bony support loss? So you can see, oh, right, okay, this has gone a little bit further. Oh, so you can see how much further that goes. And that gives them an indication that there's maybe been a bit of bony support loss down there. And you can see it doesn't go up there. And likewise here, let me turn that around a little bit and see if I can turn around a wee bit. And you can see how that can go in. And oh, look, where's that probe away to? Now, looking at your mouth, you might note there's a little bit of recession, and they might be measuring that as well. So you can get a great indicator. So lots and lots of numbers will be called while they're doing this, and they'll say if it's bleeding and probing. But look, what you couldn't see was what you can see when I take that off is where the bony support has been lost, and there's actually been a really deep pocket there. And it really helps measure these things, because this will tell them of any bony support loss and indications of gum disease and how severe that gum disease is. So that's one thing they'll be doing. Let me move my green model out of the way. So that's what the poking's around. Now, if you want all this poking, as somebody described it to me recently, not to bother you too much. The healthier your gums are, the less inflamed your gums are, the more comfortable it's going to be. So if this is all pale pink, firm and stippled, they will be able to probe away around that and do their periodontal probing, what they call a basic periodontal examination, which is where you will get numbers of 1, 2, 3, or 4. And what they will do is they will be measuring pocket, or they will be measuring to get a basic periodontal examination. And that will give them an indicator of your gum health. So you'll get a gum health score. But see if the soft tissue is pale pink, firm, stippled, and healthy, that will not bother you, and you will not have any bleeding. If it's bleeding every time they touch everything, that's a sign of inflammation. Healthy gums don't bleed. Now, so that's one thing that happens. So you can see here, now let me get a different probe. So inflamed gums are like this, red, swollen, and if any clinician starts to probe around, that is going to bleed like nobody's business, okay? Whereas on the other hand, this side where it is pale pink and firm, you can see that is going to be way easier, much more comfortable for the patient, for you to actually be in the receiving end. It's not going to bleed, it's not going to be tender. So if you think about having a boil or any sort of swelling on your leg, you touch around, it's going to be tender. On the other hand, you can poke your own skin without it being any problem. So the healthier the soft tissue in your mouth is, the much more comfortable it is, not only for actually the assessment, gum assessment, but also for actually if you need any professional cleaning, so to remove things like tartar and things like that. So what else are they looking at? They are going to also be looking at teeth, old fillings. So you will find it, I call it, again, somebody been describing to me recently, is the scratchy stuff with those pointy things. So what they're doing is they're running their little probe around these little crinkly bits, because those are quite commonly somewhere that actually collects plaque and plaque bacteria, and where cavities can form. So cavities will form often on the biting surface of the teeth and in between the teeth. Now, the thing about it is you can't actually see terribly well in between the teeth, which is why, let's see if this comes into focus, why it's so important actually to get x-rays, because you can't actually see in there underneath that. So what they'll be doing is they will be feeling around that. They'll also be feeling around the margin for any roughnesses. They can tell a lot purely even by the sensation. Is it smooth? Is it rough? If it's somebody that they haven't seen before, how do the fillings feel? Are they nice and smooth? Do they dovetail nicely into the enamel of the tooth? Or is there a ledge there? So you can see here where there's a ledge on this. So that's going to catch it. Anything like that that catches, that is going to be plaque retentive. When we say plaque retentive, we mean it keeps plaque, keeps the sticky bacterial plaque around the teeth and the gums, and it's much more likely then to have problems, either because it's right down in the gum margins and it's going to create more plaque problems here and the gums are going to get swollen, or it can be you can get more cavities developing in and around old fillings. So just because you got a filling, it doesn't mean that you're out of the woods. Other things they might be looking for, let me get another model over here, are things like crowns. Oh, let me see if I can do this without everything falling down. So they move up a wee bit, push his teeth in. So they might be looking at margins of crowns, and does that come off? Do things come off easily? So you can see here there's a crown. I just want to move that around a wee bit. So you can see if that again, plaque retentive, apart from anything else, you may not be happy about the appearance of that, but also it's one of those places that the root surface is exposed. The root surface is much softer than the enamel of the crown or the material the actual false tooth is made of. And what happens then is that can decay more rapidly. It can gather much more plaque bacteria, and it's a real pain for you to keep clean. So as I sometimes they may suggest replacing something like that. They will be looking for mobility. So does the teeth move? Is there any mobility in the teeth? And while these are tooth-colored fillings, again, they will be wanting to know what are the margins on those, like, oh, look, there's a little ditch there. Again, does that need a little bit of TLC? So lots of things they will be feeling for and looking for when you are at the dental practice. Oh, let me change my camera. The other thing that you may well come across, let me see if I can do this, is an intraoral camera. So these are hugely important for letting patients be involved in their dental treatment. So what you might well find is that they have one of these. And I can't show you my mouse at the same time as talking about it, but they may well have an intraoral camera, and I'm just going to let me just switch this back. So they may have one of these. This is my little intraoral camera, and it's great. And they come with little sleeves. So again, remember we were talking about sterilization. These get changed for every patient. But again, there's a little light on the end, and it allows you to see everything. And often your practice may have a screen attached to the chair so that you can actually see what the dental team are saying. And it can give you much more insight. So between that, the scan, photographs, all the indication of things like gum health, if there's cavities, so any tooth decay. The other thing they'll be looking for is tooth wear. So they might reflect light. And again, scans are really useful for actually monitoring tooth wear because you get that sort of detail. So lots of little things that can be used. Just let me go back to where we were with the scan. So you actually can get a lot of information during your oral health assessment, which you may not have been aware of. So no matter who you see dentist-wise, whether it's an NHS dentist or private dentist, they are still looking after your mouth and your overall health and well-being. I mean, there's no overall health without oral health. So they will look for your information about your medical, your social and family history. They'll want to know your dental history. And really important, if you've had a bad experience, what was it? I know a lot of people who don't go back to see a hygienist because they had a bad experience with a hygienist. I know people who swear they'll never get a tooth out because they had a bad experience having a tooth out as a child. So it's really important, particularly if it's a new team or a new dental professional, that you share information that has caused you angst in the past. Have you any pain? Things like, you know, what's your oral hygiene routine, any concerns? They will do your oral cancer screening, your mouth cancer screening, a head and neck examination, including your joint. So they will also check your joints and your muscles here. So they will want to check your joint, and I wonder if I can get mine. I don't really want this to hit mine, but I have a very slight excursion that mine goes out one way, but they will check your temporomandibular joint, and they will check to see if there's any tension, any tenderness up there. And again, that's an important one for tooth wear and bruxism. So lots of things going on. So there's so many things. I think I read once that during your average checkup, there's 67 things assessed. And you know something, I can see that, and I wish I could find where that was, but that I could actually list them. But there's an awful lot that is being information that's being gathered consciously and subconsciously by your dental team. They will do the charting, so they will number your teeth. They will say if there's a filling, what type of filling, where that filling is. So is one surface, two surfaces, three surfaces, what kind of restoration is, if it's okay, so if it's sound or if it's not. They will say what the material is. So it's composites, amalgam, it's gold, porcelain veneer, whatever it is. So all that information will be on that. They will say what teeth are present, what teeth are missing. They will note if there's any dental prosthesis. So in other words, is there a partial denture? Is there a bridge in there? Any other sort of appliance? So fixed retention, all that sort of thing, all will be noted down there. Are there any extra teeth? You'd be surprised how often that happens, or how any retained teeth. So some people will retain a baby tooth. So what you'll find is one of their premolars hasn't appeared, and the baby molar is still in place. And likewise, how many people have partly erupted wisdom teeth or unerupted wisdom teeth? They will record things at basic periodontal examination, and things like a B-read basic wear index. So again, so it's basic erosive wear examination. So these things all will be recorded, along with any other assessments that you need, any other diagnostic tools, so things like x-rays, if there's digital scan, any photographs. And that will then give your dental team lots of information. So you can see, sorry, I'm not moving on tonight. So things, they will be looking to see, is there any crowding? Does this bother you? Doesn't bother you? It's probably going to be fine. But what that is going to do is be difficult to keep clean. So they might advise you how to keep that area clean. Are there any fillings that are defective or cracked? So you can see the crack across there. You can see the little gap at the back there. Some of this, see this staining, take an x-ray, find out that there's more going on underneath there. One good reason is they'll pick that up and they can fill that. That's white filling material. Likewise, things like crowns, it's this sort of exposure where there's a bit of recession. And again, is that causing a problem? Is it cleanable? Is it manageable by the patient on a day-to-day basis? All really, really important. And the things that can change, that means that you sort of have always been able to maintain it and then not able to maintain it, are things like having dry mouth. So all of a sudden your self-cleansing mechanism isn't working as well. You don't have the same buffering saliva flow as you maybe did have. So these things, it's important that you're seeing regularly so they can be monitored. So look at wear. Excuse me, and it'll not just be in adults. This is marked wear on child's tooth, and there are certain things that are more likely for anybody to grind. So they might talk to you about that. Signs in your mouth of people who have recurrent vomiting for a variety of reasons, gastric reflux disease. So there's lots of things. Amazing what you can tell from your mouth. Your mouth really is the front door to the rest of your body, and your mouth reflects so much of your overall health and well-being. You might be surprised what your dental team can actually come to a conclusion about your lifestyle purely by looking at your teeth. They will look in to see, what restorations, what materials, again, what's your bite, like how you bite together. Is this a problem? Because biting like that may be that you can't get your back teeth together. So is that a problem for chewing? Look at how these teeth are aligned. Again, really, really difficult to clean around that. Likewise, this partly erupted tooth. The probing I mentioned, I said about that. And then they'll be looking for things like, again, their plaque retentive features. So tartar that builds up around your teeth. There's more there than there are here. This has got a bit stained, is in behind lower front teeth. And the reason why that you want to remove that is because once that's calcified, you can't brush that off. You can brush the surface, but you can't actually remove that calcified stuff, and that needs a dental professional to remove that for you, some sort of professional mechanical plaque removal. And the purpose of doing that is to make it easier for you to maintain. So really important to have that done when your dental team recommend it. So once they have done all the assessment, they will chat to you, they will talk to you, and you will have a discussion about the state of your oral health. And the things that they have found out about your mouth by doing the various assessment tools. So whether it's examining your mouth, probing around your teeth and gums, taking photographs, taking a scan, whatever, they're going to actually discuss all of that with you, and they will come up with a treatment plan. And that treatment plan might be, you're doing a great job, let's see you 6, 9, 12 months time. Brilliant, happy days. It might be, basically your mouth's in good shape, but you've got some tartar there that you really could do with coming back and seeing the hygienist and having that removed properly, and a little bit of advice to stop that reforming again and stop it coming back. So that's really useful. They might give you advice about things like your diet. If they're noticing something like acid erosion or new cavities, they want to know why you've got new cavities. So again, it might have been that you're having more sugar than previously. They might want to try and work out that you've got acid erosion on the back of your teeth, and they're thinking that you may have some acid reflux. So they might be referring you to, or recommending you go and see your doctor about that. Likewise, if your gums are bleeding, but your fat control, your oral hygiene is really good, and they're not really working out why that is, they may again ask your doctor to take some bloods to make sure that there's nothing else that's contributing to an exaggerated response to minimal or no plaque. So I say they were going to talk about the treatment plan, they will give you advice, and you'll have an opportunity to ask questions, which is so important. And some people come armed with their questions in their hand, and that's great because it's a good, open, healthy discussion. And you will usually, if you have comprehensive, complex treatment, you will usually get a written treatment plan with the costing as well, so that you can go away and look at it. And if there's any questions, if the practice has a treatment care coordinator, they might ring you and ask you. There will be somebody that you can ask questions. So never leave wondering, oh, I wish I'd asked. Even if it's a dose out to reception, the next patient's gone into the surgery, say to the receptionist, listen, I meant to ask, is there any chance that somebody could get back to me? It's really important that you leave the practice knowing what's going to happen next. That is the key. You want to be a happy patient. And then what you're going to do is go away and continue to look after your mouth. You know my old line, eat well, clean well, be well. It is the key to obtaining and maintaining your oral health. But it is part of that team dentistry. It's part of the thing that helps you help yourself and your dental team to look after your mouth, because their role is monitoring and maintaining your oral health. Your role is doing the daily grind of actually oral hygiene, looking after yourself. So in other words, eating well and keeping well, and actually taking the time and effort that is required to not only look after your mouth, but also your overall health and well-being. And you may find that your dental team take the blood pressure, and they may check if they think there's a risk of diabetes. They may well do that. That's becoming much more common these days. There's all sorts of things that they may actually look at based on the information you're giving them and what they are saying when you come into the surgery to visit them. So that is all I have for you this evening. That hopefully gives you a bit of insight as to what can go on during a dental visit. So during an oral health assessment, there's maybe a lot more to it than you think. And it does take time. And sometimes if people are short of time, they sort of will gather more information every time they see you. But it is really important that you invest in your oral health, and that includes maybe putting your money down if you cannot access NHS dentistry. You wouldn't ignore your eye that was bleeding. If your gums are bleeding, you need to go and see somebody who can help you. So if you're not sure, do everything you can at home, but make sure that you see your dental team regularly, and they will tell you how frequently you need to be seen and by whom within the dental team to get you healthy and keep you healthy. So there you go. Until this time next week, same time, same place. Next week, we're going to look after what happens when you actually get off your rear and exit the surgery. Most people's favorite time. And what goes on in the background to make sure that you're being well looked after. So until then, look after yourself, look after each other, and don't forget to brush your teeth before you go to bed tonight. Thanks, folks, for joining me. Bye.